here we are at Marigold's clinic in Hamilton, and we did not shoot you injecting me. Or not injecting me, administering the thing first.
No, I find that you have a bit of a challenge during that time.
I'm
So
kind of
I don't know if you want that on camera.
Yeah, we were joking. I'm sure the audience and the viewership would like and find it humorous to laugh at my expense of me.
And it's not awful.
No.
It's not awful. I think you just have a bit of fear of needles that we're getting over.
And you're hands down the most gentle
Thank you.
Nurse injector ever.
I appreciate it.
It means a lot because like this one was probably the best one. I really did not feel as though that you were drawing blood or putting this in.
That's the key. We're doing today an IV and we're doing PRP for the face. Microneedling as per the numbing cream that's currently there.
Yeah.
So I put the IV catheter in and I extract the blood that we need, and then I attach the IV to the catheter. So you have one poke, two procedures.
Is that common practice at other places? Or would someone or a nurse practitioner be more compelled to draw the blood, seal that up, and then do another one for the vitamin treatment?
I have found that's what some do. It is the most convenient thing. It requires a little bit of coordination that you have to get down, so that you don't have blood going everywhere when we do it. So it's definitely an art and a skill doing it. For my practice, I usually have IV therapy in conjunction with most aesthetic practices. So it's kind of like a hands down, that's what I would do anyway. But some people would go to other clinics just to have the PRP done and not an IV, whether it's not there or they're not a customer of that. But usually the majority of my clients come and they get both.
Yeah, I was watching and when you were taking out it looked like some coordination was happening.
Yeah, there's a few things going on. I'm using all my fingers to hold and to press and to pull out the blood. So it does require a little bit of coordination. So it does take some skill. So you can imagine I'm doing it for myself with one hand, which I do. So
how many times do you give
more
yourself...
movement.
Wow.
So pulling out the blood with, your pinky, pushing it down with your thumb.
Right.
Yeah.
That's a skill.
It is a skill. I think when I was first trying, the clinic would look like a Quentin Tarantino movie.
Oh my God.
When I was getting used to doing it, but I have learned to master it. Just being very self-reliant.
Right. Apparently.
Right. Yeah. So we're doing
so what are we doing right now?
We're doing your birthday infusion. So this is the athlete recovery. So it's the Myers cocktail, calcium, magnesium, B vitamins, vitamin C, trace minerals, and then adding on the amino acids. So your glutamine, your carnitine, your arginine, and taurine in there. And then we're gonna follow up with some glutathione. And then we're gonna do your microneedling on your face with plasma.
I've got a numbing cream on right now. And I wanted to do a vampire facial. What's the correct terminology for it?
PRP, microneedling with PRP. Vampire facial is kind of like the coin phrase.
Right.
And it's called the vampire facial because we're using your own blood. So we extract your blood, usually 10 mils of blood, put it in the centrifuge, and it separates your plasma from the red blood cells. And your plasma will be the healing and growth properties of your blood. So just as if you inject PRP into injured muscle, tendon, ligament, joint, those types of tissues, it's going to be accelerating the repair and regeneration of those tissues. So you can imagine what it's doing for your face. So it has the ability to repair very fibrous tissues. And then for your face, we're going to be microneedling. So the mechanical aspect of the microneedle is going to cause growth factors and stimulation for collagen elastin production, and then the plasma is being pushed into it.
Doing both microneedling and
the plasma.
Right.
So microneedling alone, you can do microneedling alone, and that's collagen induction therapy, and that's going to have great benefit just by itself. And then we're adding an additional benefit of putting the plasma actually below the skin and accelerating the healing. Also, your healing time is cut in half. You'll have a red face for a couple days. Nothing crazy. It just looks like you've been in the sun for a couple days. For women, you wouldn't wear makeup the next 2 days just to avoid infection and irritation.
Of course.
And so it's going to be accelerating the results, and it's also going to be giving you more benefits. So you usually see like more luminosity, more collagen production. You'll use 1% of collagen every year after the age of 25. And it's been shown that one session of microneedling, you get back that 1%.
Wow.
So each time that we do it, we're essentially reversing 1 year of natural aging, and we're going to lose that anyway.
It would be wise to do this sort of minimum once a year.
Minimum once. Usually it's sold in a package of 3.
Okay.
Usually.
Okay.
You can get benefit off of 1.
Mm-hmm.
You can. So patients say after 3 days, if they have an event on Saturday, they can do it on Tuesday and they see a definite benefit to their
Right.
face. So you'll always see a benefit even after 1.
Is there a maximum amount of treatments one can do in a year?
No, it should you should never do it within 4 weeks. It's usually recommended within 4 to 6 weeks.
Right.
The skin cycle takes that long, so it's still
Okay.
actually healing and showing benefit up to the 6-week mark.
Got
So
it.
we don't want to go back in
Yeah.
and do it again because you're causing more trauma when it's still in the healing phase. So you wouldn't do it within that period. I have some clients that do it every 6 weeks. And if you think it too, it's we think of aging and we think of our wrinkles. Our wrinkles are not getting stronger or bigger. Our muscles are not getting stronger or bigger. Our skin is getting thinner. So we're starting to see our muscles more. The muscles have been there the whole time.
Right.
But your skin integrity is changing and it's getting thinner and we're losing that collagen and that elastin. So we're losing that padding on top of our muscles. So now we're starting to see things.
Right.
So the muscles are not getting bigger. Some muscles strengthen and decrease in strength over time, but overall, the skin quality is not as it used to be.
So what about when they say you losing skin elasticity?
So that's the elastin component.
Right.
So there's collagen and then there's elastin. Collagen, we need that, but the elastin property too. That's going to be giving when you make an expression. That's going to make the pliability of your skin. So collagen is adding a lot of the integrity to the skin, and the elastin is the kind of recoil property of our skin.
So teach me then, like just crow's feet and the wrinkles around the eyes. So what's exactly happening in that case?
So we have an ocularis muscle, and that's going to be around our eye. And when it contracts, it usually contracts inward, and then it's pulling on the skin, and then the skin the integrity is not that thick anymore, so it starts to kind of wrinkle, and then it doesn't recoil back because it doesn't have that elastin property.
Got it.
So you're just starting to see the movements of the muscle below the skin.
And so is it possible to thicken the skin?
That's what we're doing right now.
Okay.
So the collagen induction therapy, we're thickening the skin up by doing this, by creating microchannels using the microneedling and creating a micro trauma. And it's about causing a little bit of trauma that you can then recover from.
Hormetic stress?
It's a hormetic stress,
Yeah.
and it's not too much. You're gonna see online where like the Kim Kardashian, when it first came out of Vampire Facial, her face is red and it's covered with blood.
Yes.
We want to find pinpoint bleeding, but nothing too intense,
Right.
because we want to be able to recover from it. If someone has acne scarring, that's like boxcar scarring, that's more intense and deeper, you would have to go a bit deeper to cause that type of effect, but you don't have any of that right now, and that'd be very specific to that person. It doesn't have to be intense, and usually recovery can be within 2 days. I'm gonna be giving you a mask as well. It's gonna accelerate healing, and just aftercare is really important afterwards as well.
Okay, so I guess you're gonna see me. Are we gonna show any of the procedure at all?
Yeah, we can do that.
Okay, so let's see. You'll see what this looks like soon enough. All right.
Okay.
So there she is. She's gonna have it really good in there. Okay, there we go.
Okay. So we're using the skin pen, which it is Health Canada approved, and it's approved for many different indications, including melasma and wrinkles, arthritis, fine lines. And then this is our plasma. So we've already spun that up. And then so you can see in a clip later on how we spin it up and what it started off as a 10 ml of blood. And we have about a 6 ml yield of plasma for your face.
Cool.
So we're going to put that onto your skin.
Now, is plasma typically more translucent, like clear?
Yeah, it can be. Sometimes there's a bit of red. So say if like a red blood cell kind of gets into it, it just darkens it up a little bit. But as long as it's nice and transparent, which it is.
Got it.
So when it's a bit cloudy, there's a bit of concern. You can tell a lot about someone's blood by looking at their plasma. And the health of your person determines the health of your plasma.
And how does my plasma
That looks
work?
great.
Yeah.
Yeah, so if it's cloudy and you can't see through it, usually you have higher lipids within your blood. So that's usually reflected.
And how cool is that? Like, I'm dominant. I eat meat.
Yeah, so it's not like if you have like clients come in and It's very cloudy, atypical, that they had fast food within hours before we did it. So it can actually show up within the same day.
Got it.
So that's not that bad.
Cool.
And then the skin pen is that we use different lengths for different areas of the face.
Right.
So we usually start off at like 1 millimeter, and then we increase the depth based on the skin. There's not much padding up there. And then there's more fat on your face, more tissue on your face. We can go a bit deeper.
Got it.
So if it's uncomfortable, you'll be fine. But if it's uncomfortable, we just decrease the depth. If you're working on acne scars or anything a bit more intense, surgical scars, you go a bit higher, but we usually keep between the 1.5 and 2 range for your face.
Okay.
So, and if you can see that, but turn on, and then the needles will be going in a perpendicular way. A lot of people use a roller. Rollers can do more damage than benefit because the needle is rolling into your skin on an angle and then pulls out on an angle. So it can cause more of a shearing force while this is kind of in and out, and then you move along the face. Let's get started.
You heard it here first.
Okay.
So this white stuff is, can you still see it? Is it still
You can
there?
still see it.
Okay.
And I leave the numbing cream on the areas that I'm not treating just to keep it working on the skin because you still have optimal patient comfort. And then you just let me know.
Feels weird.
It feels numb.
Yeah.
Right? Now let the alcohol dry.
So for those that are watching, this is the second time I've done this.
The
first time was well
couple
over.
years, 2 to 3 years ago,
Okay,
I think.
so I will make it a priority to do this more often to actually get the benefits, the long-term benefits, the ongoing benefits.
Ongoing.
Yeah.
More than once a year on your birthday.
Okay.
Right?
Yep.
Are you ready? So I'm applying the plasma on the skin, and it's used as a glide. So if you did not use plasma, you can use a glide like a hyaluronic acid as the glide. And there's a difference in price. Obviously, it's more expensive if you're using the plasma version than microneedling. So if it's not in someone's budget to have the plasma version, then you can just get microneedling without. Okay, you ready?
Yep.
How's that feel?
It's okay. What are we doing now?
We're going to be doing a subcutaneous NAD. And we're going to ask you what NAD is.
Nick, you
You don't have to say the word, but
NAD is it not a precursor to?
so
No, it's not a good. It's not.
it's okay. It's okay. It's
I butchered it.
there's ways that NAD is working that we still don't understand. But if you remember the Krebs cycle when we were in school, where you took like grade 12 biology, we took the Krebs cycle many times.
Yeah.
So NAD is a cofactor with oxygen that makes ATP.
Got it.
So you need NAD, you need oxygen in order to make ATP, and the ATP is the currency for the cell. So that's how it's in every cell, whether it's your brain cell, your muscle cell, your heart cell, your skin cell. It allows it to function more optimally because it's creating the energy potential for the cell to do all of its functions. So after 30, that's known to rapidly decline, and it's considered to be the anti-aging molecule because if we replenish that, the cells will function as they did when they're much more youthful. So we find the older you get and the more stressors that you have on your body, the more you benefit from it because the more it's been depleted and the harder it is for it to replete.
Right. So how does our body, how can we obtain it? Not in the form of, subcutaneous
So we have like
injection?
NMN and NR are the precursors to creating NAD within the body. So if you don't have the ability to actually get the straight NAD plus, then you can take precursors to do so. And based on the food that we consume, if you have a healthy, nourishing diet, those will create the cofactors
If you've
in
got a
our body.
sealed gut,
If you
if you
just look at.
you might be a little deficient.
So if you are more healthy, your body can make more things like glutathione. We make glutathione in the body, but if you give it enough of the substrates in order to make it.
Sure.
But even if we have the most healthiest diet, NAD will continue to decline as
course.
part of the normal metabolic aging process. That's just a part of it.
Yeah.
But if you have pharmaceutical medications, if you're stressed, if you're on night shift, if you're working out a lot, even that's going to be considered a stressor. You're depleting the NAD because you're asking your body to keep on creating energy.
Right.
So whether you're a professional athlete or whether you're an 88-year-old man who has some neurological issues, it's neuroprotective and it's known to be beneficial for those who have Alzheimer's and dementia.
Yeah.
So a lot of my patients, they're athletes, but also to the elderly who are trying to mitigate a lot of the symptoms.
So everyone benefits.
Everyone benefits.
Yeah.
I give myself NAD every week. Not the infusion, but definitely in injection, and then the infusion every 3 weeks or so.
All right, so let's.
Let's do it. So I usually put this in the fat. You don't have too much of that. So I have to just separate that. And there's a little bit of a pinch.
Doesn't hurt. No stinging, nothing.
There you go. And then that would be 100 milligrams, and the infusions are typically 500. So the average infusion. So this is a smaller injection. You can't do more than 100 at a time. Other than that, NAD is preferred to be diluted over a period of time.
And I do remember the last time you gave me a shot, I did feel a little.
You feel like 5 to 10 minutes of a little bit heaviness in your legs, a little bit of butterflies in your stomach, and increase in your heart rate. It's usually done by 5 to 10 minutes.
So then on that note, I'm going to go back to the chilling lounge chair. And yeah, that's it. Okay, so Biohacking Expo, you're definitely going to be there.
Down.
You're going to have a huge IV lounge.
Yes.
And we would love to see you speaking.
Of course.
And having some workshops.
Of course, yeah.
So for the professionals, I think you've got something in store. And then you've got something in store for the general public as well.
As a consumer.
Yeah.
So about all these different vitamins, minerals, the purpose of them, going to some of the functional medicine tests that we provide. And then for clinicians, how do you incorporate IV therapy into your practice and to become a pro?
And then also, there are so many people that are wanting to just get their blood work done and getting a requisition. And it's very difficult.
How do you get started? Yeah.
Right. So you're going to talk about that.
Yes.
Okay. So we will see you at the Biohacking Expo August 9th, 10th, and 11th with Mary Gold and get some IV treatments and learn all things longevity, wellness, and biohacking.
Sounds good.
Cool.
See you there.